Hello and greetings, everyone, to another episode of Arthritis at Home. I'm Kelly Lendvoy, VP of Communications and Public Affairs at Arthritis Consumer Experts. And it's my pleasure today to welcome back Ms. Wang, who is ACE's programs coordinator. And together we're going to take you through part 2 of our national survey on arthritis and health literacy. Hello, Ellen.
Kelly, it's always great to be here. Thank you for having me.
So we actually spoke on an Arthritis at Home, an earlier episode, about part 1 analysis, the general overview of this national survey that ACE conducted with Canadians on arthritis and health literacy. And in that first episode, you clearly defined that when we talk about health literacy, we're talking about the ability to access, understand, and use information as a way to maintain and improve one's health, a pretty standard definition. What we found in that first part is that if a person has issues with health literacy or has limited health literacy, that can create barriers in terms of accessing health services. It can lead to an ineffective use of those health services, and down the road lead to the development or a worsening of a chronic disease like arthritis, and people can get sicker. So with that in mind, Ellen, in this part 2, what I want to talk to you about is to do sort of a deeper dive and look at the differences in survey responses between BIPOC and white respondents that took the survey from across Canada. And maybe to start us off, can you remind us again, who were the survey respondents?
Absolutely, Kelly. And we at ACE want to thank everyone who took the time to complete the survey because, once again, we're only able to report and to draw these not conclusions, but really find really good information and, information that will help guide not only our work, but maybe informative for other researchers and healthcare providers, because we've had such a large sample size. So a total of 1,148 respondents had completed the survey, 699 of whom identified as white. So this was about 61% of our sample, or you can think about 3/5. And about 449, or exactly 449, identified as BIPOC, and this is about 39%, 2/5. And if we broke that down a little bit more, 48 of these responses were from individuals who identified as Black, 280 from those who identified as Indigenous, and 121 from those who identified as a person of color. So we can see this beautiful distribution. And in surveys, that's what we really hope to, we aim to do, is to capture that distribution so that we're able to say, these results are closer to what we would find in the real world. So really, really exciting. And again, thank you to everyone who completed the survey.
Now, in previous national surveys that ACE has conducted over the past couple of years, navigating the healthcare system and navigating the world of health information proves to be very challenging for a lot of our members and subscribers and for people living with arthritis. In terms of health information, it can come from various sources. So it can be online, obviously a very, very popular resource area or destination for people. Mainstream media, magazines, newspapers, radio, television are often talking about health issues. And even, opinions and advice from family and friends. These can all be sources of information that people go to when they're trying to understand their own health. How do the BIPOC and white respondents in our survey, Ellen, compare in terms of understanding that health information that they're seeking and receiving?
Right. Kelly, this one kind of surprised me. And I say this as a researcher who also acknowledges my own biases. So I had a bias going into this question of, what are the differences, or if there were any differences in understanding? And we actually found that there were very similar levels of understanding across online media and in conversation. So this is between BIPOC and white respondents. There seemed to be very little difference, or in some cases actually favored higher or greater levels of understanding in BIPOC. So for example, online health information, whether that's websites, blogs, podcasts, social media, and videos, BIPOC reported about 35% in terms of understanding, and white 19%. And this could be explained if you think about it. There's a lot of websites, blogs, podcasts that are in the native tongue, or perhaps they're able to offer captions that break down that language barrier in terms of understanding. So there could be lots of reasons why, but we did see that, for example, slightly higher, but overall in media, in conversation, relatively similar. So both groups just seem to be doing well in the understanding component. Doesn't necessarily mean the application is the same, but we saw that understanding seems pretty fair.
Okay, let's talk about that application. So as it relates to a person living with arthritis communicating effectively with their healthcare team, and we know there are many various members of that healthcare team, what did we find in terms of how BIPOC respondents differed possibly when it comes to interacting with their healthcare providers?
So like everyone, individuals with arthritis may go in or have multiple concerns. And we also know that no matter what, appointments are short, right? We know that appointments are short, usually limited so much time to talk about each concern. But in this case, we also ask specific questions in terms of not only understanding or explaining, in the case of the healthcare provider, explaining health issues, information in ways that were easy to understand. We also asked about medical jargon that was used. And we also asked the question, did you feel listened to during your interaction? So did you feel listened to by your healthcare provider during interactions? And we found across the board, and this is despite high or comparable levels of understanding. It's not an understanding issue. There seems to be greater challenges that occur or that manifest when we interact with healthcare providers for someone who is, for example, Black, Indigenous, or a person of color. So one of the specific results we saw was about 12% of BIPOC respondents answered often when asked if healthcare providers explained health issues clearly. So only about 12%, right? Again, often, which was the highest you could rate it out of 5. We had a 5-point scale in that case, about 12%. This is when compared to white respondents who answered about 19%. Really, you could argue both need improvement. But we did see that difference, and the same was seen for medical jargon. There was higher use of medical jargon, as well as feeling listened to. So only about 16% of BIPOC respondents expressed they felt listened to, again, often. So when we asked people to rate, often was the highest rating, when compared to about 21% of BIPOC respondents. So there's a little bit of a difference there. And, again, we can hypothesize about why, but I think across the board, we can do more as healthcare providers about communication.
Now, another way that patients use health information is to enable them or equip them to be able to understand their disease and their bodies, and making the right choices, whether it comes to medications and treatments or therapies, their participation in physical activity or exercise, eating the right foods and making other sorts of lifestyle decisions. Did we ask any questions and did we find out, um, in terms of using health information, how they used it to make better health decisions?
We did. We actually asked kind of three separate domains and three separate, what we'll label as self-care domains very broadly. So we looked at medication, again, a very important part of arthritis care. We asked about exercise, absolutely foundational, and we asked about nutrition or diet. So we had asked within each of those domains, for example, do you understand? Do you understand? Are you able to do it? And are you confident that you can keep it up? So we asked really well-rounded questions, not only getting at someone's understanding, application, but also their confidence to continue doing it. So for exercise, not only, do you exercise, or are you confident, but also, are you confident that you're able to exercise consistently? And across the board, we saw, you could say, stark differences between BIPOC and white respondents. So in the case of medication, so understanding the purpose of each medication, we would hope that this number is really high. So white respondents, 62%, we can think about it, 2/3, right? 2/3, okay, pretty good, we can do better. For BIPOC respondents, Kelly, we had about 32. So only 1/3 of BIPOC respondents reported understanding the purpose of each medication they were taking. And the same was seen for exercise, in terms of understanding the purpose for exercise, participating in exercise regularly, as well as confidence exercise. And the same for healthy diet and reading food labels. So this was a very consistent trend and very stark difference. So it wasn't a few percentage, it was a large percentage difference.
So maybe not just an issue of accessing, evaluating, using information, but maybe it suggests that there might be some sort of breakdown in communication, whether there are cultural barriers, possibly. There being that patient population that you're describing being told about their medications as an example, but maybe them not really being able to process that information.
Exactly, Kelly. Highly likely. I mean, we can't speak for the individuals who responded,
Yeah.
but it's very possible and very plausible that, like you said, whether, it's perhaps the healthcare provider did tell them the purpose of each medication, but to remember it, right? It's difficult, especially if it's a new medication. So thinking about ways, and this is no critique of healthcare providers on doing their job, are there ways that we as a system can support health literacy? Can we have a handout that is translated in the individual's preferred language that they take home that describes each medication in lay 3 to 4 lines?
Those kind of thoughts and recommendations are going to inform us certainly into next year, into 2024, when we're working not just in patient education, but in advocacy as well. Any other conclusions that ACE drew from the survey before we finish, Bill?
Yeah, Kelly, one of my favorites, and this is something that, I wasn't really expecting, but it wasn't surprising to find. So, for example, when we asked individuals about how they want to improve their health literacy, how they want to learn, how they want to gain knowledge, BIPOC respondents, this is across age, this is across gender, had reported attending workshops and webinars as something they want to do, as well as going to support group meetings and following self-help guides online. So these numbers were about 50%. So 50% for each of those, which is rather high. So every 1 in 2 people had said, yeah, I'd be interested in this. And this was, again, in contrast with white respondents who, seemed to be less interested in attending workshops and webinars. We could hypothesize about why. Maybe there's a few too many, right? Or maybe there needs to be ones that are a little bit more innovative with data, with information that's more lay. Again, we need to collect more data. Surveys help us generate questions. They don't really answer questions. This is something I've learned recently. And then simple things like, for example, creating those environments where you can learn together, right? BIPOC respondents do take the word of family and friends, as we know, really very much so to heart. And even though they're in this kind of communal mindset in terms of learning and wanting to learn, they actually have a really hard time asking for help. So this is across the board. Once again, BIPOC respondents, and especially BIPOC men, reported that they had difficulty asking for help. So again, like you said, there's some sort of breakdown, even though there's lots of will to learn, really lots of excitement to learn in a communal setting. There seems to be a slight breakdown, whether not a breakdown, but somewhere that things aren't clicking, and that may be because of cultural norms, right? Again, we can only hypothesize to ask better questions, but I found that piece really interesting.
I know it raises more questions from the survey, and that's what surveys do, but thank you for being able to answer some of our questions today. We really encourage people to look for the link at the end of this interview and be able to take a look at this part 2 of the Arthritis and Health Literacy survey. And certainly if they have any feedback or questions, they can get a hold of us at Arthritis Consumer Experts. We always look forward to getting that feedback. And obviously, as you said in the beginning, we thank everybody who participates in our national survey program. It's foundational work for ACE and really guides and directs us for the next work plan year in 2024 as an example, being able to sort of draw upon the lived experience that is revealed in these surveys. It's just so important to us. So thank you again, everyone. Thank you for viewing. And Ellen, thank you for joining us again on Arthritis at Home.
Always a special time for me, Kelly. Thank you for having me.
All right. Okay, stay tuned until the next episode of Arthritis at Home. Thanks for joining us today. Goodbye.